Welcome, Dr. Saad.
Assalamu alaikum. I'm Dr. Saad Saab. Today I will talk about, inshallah, I will share the screen first. And so today, inshallah, I will talk about the infection prevention and control of COVID-19. So these are the outlines of my presentation. I will talk about some introductions, application of standard precautions, implementation of empiric additional precautions, environmental controls, handling of laboratory specimens. So what does infection prevention and control means? It is a scientific approach and a practical solution designed to prevent harm caused by infection to patients and health workers. This definition of IPC came from WHO. So as a reminder, the transmission of COVID-19, as we can see here, the infected individual can spread the infection through droplets, which is more than 5 microgram in diameter and travel in 1 meter and less. It can affect the susceptible individual by direct contact or indirect contact, like touching the infected surfaces like tables, beds, and the other surfaces with the droplets. It could be also infect the susceptible individual by direct contact to the infected individuals. There is a question mark about is it airborne infection transmission or not. As the last update of WHO, they said there is one study confirmed that it is an airborne transmission, but it's not published yet. So they said it can be airborne, but it's not confirmed yet. So they put it as a question mark until more study published that confirming or not confirming the airborne transmission. So the main transmission is droplet, and keep in mind the airborne transmission. So the standard precaution, it is a set of practices that are applied to the care of patients regardless of the state of infection, either suspicion or confirmed, in any place where health services are provided. It is consists of hand hygiene with alcohol-based solution or water and soap, use of personal protective equipment according to the risk, respiratory hygiene, or what they call it cough etiquette, prevention of needle stick or sharp injuries, sterilization, disinfection of medical devices, and environmental cleaning. So what does, I will talk about the respiratory hygiene. As Dr. Muhammad Ashraf said, the respiratory hygiene is cover your mouth and nose with a tissue when coughing or sneezing, or use a mask when you are having these symptoms, cough or sneeze, or you can flex your elbow and cough or sneeze in the flexed elbow. And you have to wash your hand, and also you have to dispose the tissue that you coughed on to a disposable trash. The prevention of needle stick or sharp injury. All personnel working in a health facility are exposed to accidents with sharp. And how can this be avoided? You can use gloves, safe handling of instruments, separation and safe disposal of used sharps. This is important. The communicating verbally when a sharp object is handed from one person to another. Sterilization, disinfection of medical devices. The health center can sterilize the medical device either by steam sterilization or flash sterilization. The disinfection with either chemical disinfectant like alcohol, chlorine compounds, or with ultraviolet radiation. Environmental cleaning, we will talk about it inshallah later, inshallah. Personal protective equipment, PPE. It's equipment placed to protect the healthcare workers or any other person to get infected. So it is consists of gloves, long sleeve gown, face mask, either surgical mask or N95 respirator, face shield or goggles. Implementation of empiric additional precautions. As we can see here, we have three different precautions: contact precaution, droplet precautions, and airborne precautions. Contact precautions. The healthcare worker should wear a long sleeve gown with gloves. The droplet precaution, same contact precaution plus surgical mask and face shield or goggles. Airborne precaution, the healthcare worker should wear a long sleeve gown, gloves, N95 respirator, and face shield or goggles. So when we can do a droplet precaution or airborne precaution, this one, according to the Saudi CDC, so for any suspected or confirmed case of COVID-19, you have to apply standard plus contact plus droplet precautions and stand 1 meter range of the patient. If for any also suspected or confirmed cases of COVID-19, and you are going to do aerosol generating procedure, what I'm going to talk in the next slide. So you have to apply standard, contact, and airborne precautions. So if you are not doing the aerosol generating procedure, you will wear a long sleeve gown, gloves, a surgical mask, and face shield or goggles. If you are going to do aerosol generating procedure, you have to wear a long sleeve gown and gloves, N95 respirator, and face shield or goggle. So the aerosol generating procedure, it is a nasopharyngeal swabbing or tracheal intubation, non-invasive ventilation, tracheotomy, CPR, cardiopulmonary resuscitation, manual ventilation before intubation, bronchoscopy, suctioning. If you are going to do this procedure, one of these procedures, you have to do airborne precautions.